Hi, my name is CJ Devgan, and welcome to Season 2 of Breaking Barriers. My goal for Season 2 is to discuss how digital transformation is redefining how care will be provided in the next 5, 10, and 20 years. I will be talking to leading minds in the healthcare sector and exploring how new disruptors are leveraging technologies such as artificial intelligence, population health, blockchain are reshaping the healthcare universe.
Hello, and welcome back to another episode of Breaking Barriers. As we discussed in our previous episodes, our focus for this season is the significance of digital transformation in the healthcare sector. My guest today is Jacques Lirette. He is a Senior Director, Executive Service at Infotech Research Group. Jacques has been serving the healthcare sector for the last 25 years in a variety of IT leadership roles. So without further ado, let me welcome Jacques. Hello, Jacques. How are you doing?
Hi, I'm doing great.
Excellent. Thank you for sharing your valuable time with us. Would you like to share more on various roles you have worked in? And may I also ask you to share a fun fact about yourself?
Yeah, I've held a variety of different roles, either directly in healthcare or serving healthcare. So I was a CIO for a hospital for about 10 years. And then after that, I worked in a variety of companies selling IT solutions to healthcare, assisting companies preparing their message for CIOs and so on. So I've had a variety of roles within serving healthcare or in healthcare. And a fun fact, I'm an advanced scuba diver, and one of the things that I love to do is go dive where there's sea turtles. It's kind of a passion of mine. And last year I had the pleasure of diving in one of the places where my hero Jacques Cousteau was diving in Thailand. So it's one of those things where if I could do it every day, I would.
Excellent. That's interesting. So how many different places have you gone and dived?
Interestingly enough, I only started diving later in life. I probably have about 50 dives so far, and I've dived in the Caribbean, mostly in Thailand.
So that is 50 more dives than me. It's a passion for me too, but I have not been able to get around and get my certification. I do a lot of snorkeling, but I've never done scuba dive. That is something on my bucket list, and hopefully this year I should be able to cross that off my list.
Well, it's something that is very it's fun and relaxing to do. So it's a great thing.
I bet. So let's get back to the main topic on the serious note. Challenges that our healthcare system is facing today and how digital transformations can solve. So please share with our audience, from your vantage point, what do you think are the critical challenges being faced? And if I may ask, can we break those challenges by various entity types, such as providers, payers, pharma, medical device manufacturers, regulatory agencies, and most importantly, the patient?
Sure. Why don't we start with the patient? Because I think that's where the challenges for the rest of the system comes from. I would say today, with the amount of information at the disposal of patients, they expect greater service, rapid service. They expect access to the healthcare system in ways that they access every other aspect of their lives. So when they do banking, they go online and do banking. When they when they want to consume media, they go online and they consume media. And the challenge for the healthcare system is being able to respond to those needs in the way that a consumer is looking for services. And that putting a lot of pressure on the different levels of service delivery. So if you look at the primary care physician, one of the challenges that they have is that for the most part, patients come in with more information at their disposal that the primary care physician may have, and they almost pre-diagnose themselves. So by coming in fully informed, it puts a lot of pressure on the primary care provider to quickly and properly diagnose and properly recommend course of treatment. So when you go one level up, then from the primary care, then you have the acute care or the hospital sector or the private care facility that has a lack of data. So there's so much a discrepancy between the connectivity between the different care providers that the flow of information doesn't readily go from one provider to another. So there's a disconnect between primary care, and there's a disconnect between acute care, and there's a disconnect between private care, whether it's a physio or whether it's a radiologist or whatever the practitioner may be. So one of the big challenges for the system as a whole right now is connectivity and data sharing. And what's putting pressure on organizations to overcome is all the pressures, financially. How do you build a system fast enough to be able to accommodate the need of a consumer that changes their iPhones every 3 years and expects their applications to be renewed every 3 years? And so how do you build that infrastructure and information systems that meet those needs? Second, you've got financial pressures. You also have pressures from leadership of organizations to also restructure and modernize the healthcare system. So you hear about all these jurisdictions across the country or even internationally where there's mergers and acquisitions in hospitals, in the hospital systems in the US or in Canada. You have mergers and acquisitions forced by government. So regionalization of healthcare delivery. So the continuum of care is really suffering because of that. So there's a lot of pressure on organization leadership to consolidate the system. And that puts pressure on the digitization or going digital for that matter.
So here's my question, and excuse my ignorance, but having been a servant of healthcare and IT for past 20 plus years, 25 plus years, I have a hard time understanding why these pressures are unique to healthcare. Because you mentioned an example of online banking and banking as a whole. There's a lot of M&A that happens in banking industry as well. May not be so much in Canadian space. We have very stable 5 banks. But if you look outside, there have been a lot of mergers and acquisitions within the financial industry and sector. But they are able to transmit data, and I always give this example that I travel a lot because of work. And if I have to be in India, for example, and then I need some money, I will just go to an ATM machine and insert my Canadian Interact card and enter my PIN, and the machine will dispense me money. And that machine, that Interact machine that I went to, or ATM machine I went to, could be of any bank in India, for that matter. And they will be able to identify me, validate my PIN, communicate with the bank in Canada and dispense the amount of money, and then put proper credit into my total balance. And all of that happens within minutes, if not seconds. So that interoperability of data is the question that I am not able to ever put my arms around as to why a data from physicians' EMR, my PCP's EMR, cannot get transmitted to my hospital's EMR, and vice versa. So what, in your point of view, are the real challenges that these systems cannot communicate? I'm pretty sure the banks in India may not be using the same information systems that banks in Canada are using. So help me understand that.
So I will answer that, Wei-Li, with 2 points. The first point is data standardization. So in healthcare, there's so many different systems that are in place that are EMRs of different varieties and flavors, and the consistency and the data standards for the complexity of that data is not easy to transmit from one system to another. So that is definitely where the biggest challenge is in terms of data sharing. But the second aspect of that is monetization. So in the banking systems, there is financial rewards for transmitting that data from one institution to another, because the customer, there's usually transaction fees attached to it. There's usually a monetization process where when banks exchange data or use another ATM of another bank, because the data standardization is better on the financial side for communicating transactions than it is on the healthcare side. It's easier to do. And the second thing is that there's monetization. So there's money changing hands to accommodate those consumers that travel. So there, in the healthcare system, that's not there. So there's no financial incentives to build those connections. in the healthcare system as it exists in the financial systems.
So I will push you a little further on this. Again, one standard. So there are standards, right? SL7 has standards. NSI X12 has established standards. And if those standards are not complete, then we have been in this information revolution for past 40 years now, at least since 90s, if not more. Then why could we not get these institutions to get to those standards, like financial sector, A, and B, monetization of these things, which is a very valid point, where transaction fees are applied and individuals end up paying. But that can be embedded in our healthcare cost, right? It will end up reducing the total cost of care being provided, because there's no doubt in anyone's mind that if we have this free flow of information flowing from PCP to acute to radiologists to pharmacies and all that, we will see a decline in number of procedures being performed, number of tests being performed. So the total cost on a system will come down. And who end of the day end up paying these costs? In Canada, it is very easy and simple. It's the government, provincial governments. In US and other sectors, it's the health insurance companies. So there is definitely, these entities will be willing to pay that 15 cent or $1 transaction fee if it actually boils down into saving system costs.
Totally agree. And that argument has been put forth by many governments or many consumer-driven healthcare advocates. You see that all the time. If you improve access to the healthcare system and you improve the efficiency, there's payoffs. The challenge is that right now the healthcare system is siloed. So there's no, even though the benefits to the overall healthcare system may be there, the incentives don't spread across the spectrum. So primary care is a silo. Private care for some specialties that you get private services for is another silo. You've got hospitals that are a silo. You've got long-term care that's a silo. You've got ambulatory care that may be another silo depending on which jurisdiction we're talking about. So it's easy for us as IT professionals to look at that and say, wow, if I take that whole system and I improve efficiency and I improve all the communications and we produce a healthcare data system that's equivalent to the banking system, and quite frankly, it's not a fair comparison because the complexity of the data is way different. But it's the model that people tend to go to. If I can walk into any institution around the world and get some money, why can't I go and get healthcare the same way? And it's just because all the different silos have built different systems for themselves, and the data standards are not there to push it. And even the financial incentives coming from taxpayers, even though we all want it, nobody wants change. We've seen governments try to implement change and try to consolidate change. If you make your organizations more consolidated, you have a better chance of sharing data within that organization. But people don't like that change. People don't want to see change to their physical healthcare infrastructure that's been in place for decades. And that's the primary challenge. In the US, I have the pleasure to work with some large healthcare institutions in the US, and they don't see it that way. They see it very differently. There's a lot more data sharing and a lot more transactional kind of systems in the US than there is in Canada because it's business driven. The insurance company has a vested interest in making sure that the rest of the system's more efficient, and vice versa because it's all based on profit.
That is all for today. We will continue our conversation with Jack next week. Thank you for listening. That is all for today. Thank you for listening. If you are a healthcare executive and grappling with challenges to transform your organization, contact me and let's talk. If you like our show, please subscribe, leave a rating and a review for us on iTunes. Ciao and have a productive week.